Drug addiction is the compulsive use of illicit or prescription medication that often people use despite building negative consequences in their life. So what starts out as a fun activity, at some point they cross a line. So the fun becomes something a bit more serious. It starts to take over their life, their decision making, and they begin to lose things. They lose their relationships. They lose their trust from the family members. They lose their jobs and their careers. So it starts to have an impact on every area of their life. It affects probably any part of society you can think of. It's what we would call an equal opportunities employer. So drug addiction doesn't care which country you're from, what your ethnicity is, what your religious beliefs are or are not. It's across all social strata. It doesn't care if you're rich or you're poor. So it affects everybody in the world. And there's not many people who can't say that in their family there's some form of addiction or some relative. So really all of us can understand how addiction can affect people. Physically, drug addiction, it affects the body in many different ways. The body begins to rely on the substance. So if the substance isn't there, it starts to crave it. People start to need the substance to feel normal within their body. Emotionally, the use of the drug becomes a way to stave off difficult emotions. So any difficult emotion that a person is feeling, they'll see that the answer to that emotion is in taking drugs. So it squashes them emotionally. What we find when people stop taking drugs is they really feel the physical consequences through the withdrawal symptoms. Maybe some of the effect it's had on the body, the wearing down of the system of the body. The effect of the drugs numbs those consequences. So often they become aware of how their body's broken down when they stop taking the drugs. And then physically when they stop, they get the withdrawal symptoms. And they can be both physical and emotional. Often people ask, is drug addiction a physical or a psychological problem? And the answer is that it's both. With some substances, there is a definite physical addiction. So the body actually begins to need the drug to feel normal. And from a psychological perspective, many people start to take drugs because it makes them feel better. So why do they want to feel better? Usually there's some underlying issue that's caused that. It could be a physical issue. It could be that they're experiencing some pain, physical pain, and they take the drugs to numb the pain, but then this becomes a habit. It could be some emotional pain or some trauma in their life. They get some relief from the drugs. And, it's funny, in some ways, with some people who have a huge amount of trauma in their lives, some people say that their drug addiction could actually have saved their lives because the taking of the drugs may have got them through situations that psychologically they wouldn't have been able to handle without some form of emotional crutch that the drugs can provide. Some people see drug addiction as a moral issue. They believe, well, people have a choice and they can choose not to take drugs. But I think, if you start from that starting point, that somebody's doing something wrong, it's going to be very, very hard to treat someone. This isn't a question of morality. This is a question of a pattern of behavior that becomes entrenched. It's a pattern of behavior that people use because they're feeling some dis-ease with themselves. The treatment is a process that starts at the Kusnat practice. It goes beyond a person's time at the Kusnat practice. Normally, always it starts with a medical process, either a detox that's managed by the medical team here, along with our partnerships with some of the local medical facilities here. So the very first thing that we aim to do is to get the person off of the substance of choice as soon as possible, in the most comfortable way possible. So with a managed, supervised medical detox. Once we got through that process, then we can start to bring the other aspects of the treatment program here into play. So we have what I would call in the Kusnat practice a holistic approach. It's a very, very overused word in the treatment of addiction. But for us, it means treating the mind, the body, the soul. It means looking at the whole person and putting the person at the center of the program. So we tailor-make the program to suit each person, to suit the goals that they want to achieve. And we use all the best experts from around the world to help them achieve their goals. Part of the treatment of addiction means to look at some of the underlying causes. So the things that maybe started them on the journey in the first place. As part of the supporting the medical process of detox and supporting the treatment as a whole, we have a very strong BioR program here. Biomolecular restoration is where we take very intensive tests of a client's values, blood values, and we use a range of supplements to help rebalance the body and brain chemistry. This is particularly useful in the detox and post-detox phase, because when you take the drugs away, the body chemistry is changed. So the body is still crying out for the substance. And we find that through use of the BioR program, we can level out the body a little bit more. Not completely, but it levels it out into such a way that the process of cravings is lessened in people during the early phases of the detox. Okay, so when we're addicted to drugs, they have an impact on the brain. The brain really is where the drugs work, and they work mainly on the reward system. So the reward system is the part of the brain that releases dopamine. Dopamine is the chemical in the brain that makes us feel good. It makes us feel relaxed. So when we take drugs, we feel better. When we stop taking drugs and the dopamine reward pathway is confused, often we'll feel bad. It doesn't know whether to produce it or not produce it. Often the BioR program comes into its own in helping to rebalance the brain chemistry. So it kind of takes the edge off this process of having the reward system externally stimulated all the time, and we can start to use natural products, natural remedies to keep the system more in balance. So usually addiction to drugs usually begins in a fairly innocent way. We take drugs to have fun, to feel better, maybe to fit in sometimes. Maybe there may be some social anxiety, and if our peer group is taking drugs, that we'll feel that we need to take the drugs to fit in. And usually there's some payoff. We take the drug, we feel better, we have some fun. So peer pressure is definitely one of the ways in which the use of illicit drugs or addiction starts. Also, availability is an important factor. If you're in an area where it's easy to access illicit drugs, or if you associate with people that always have drugs, then availability can be a core component. We mentioned trauma earlier. Often if there's some traumatic events in people's lives, then they may be seeking some kind of escape. And all of this starts off as a fairly innocent process. It starts off as the human being just trying to feel at ease. And maybe they like the feeling, they like the sense, the high that comes with their drug of choice or drugs of choice. And there the seeds of addiction can be sown. And there are some of us in the population that lose control very easily. And there can be a number of factors that predict that. There's a lot of research suggesting that there's genetic factors, there's social factors where we live, who we live with, what our home life is like, and there's psychological factors, our susceptibility to pressure, or like I mentioned before, if we're experiencing high levels of anxiety or stress in our lives. These can be all things that can lead us down the road of addiction. Of course, we've mainly covered illicit drugs here. There is I would say a new phenomena, but it's not really a new phenomena, but it's hitting the headlines now, is the misuse of prescribed medication. You can't pick up a newspaper or watch a news program now without seeing the impact that the misuse of opioid medication is having in the United States. And actually that's something that is experienced at many different places in the world, not just America. Prescription medication usually starts off with a prescription. So we go and see a doctor, a trusted medical physician, and we go because we have some physical or emotional problem. And they will listen to us, listen to the problem, and they will prescribe us a medical solution to our problem. And we trust that process implicitly. We trust the doctor because we believe he has our best interest at heart. And also we trust the medication because it's got a label on it with our name and a dosage. But a similar process can take place with the prescription drugs that takes place with the illicit drugs. They make us feel better. They make us feel better when we take them. So maybe we take some more of them because that will make us feel even more better. And then maybe our behavior might change a little bit. We might start taking other people's medication, or we may start to manipulate our doctor to get more medication. And this has the same outcome as illicit drug use. And actually the experience in the United States at the moment is when people find out that they can't manipulate their doctors anymore, they move from the prescription drugs to the illicit drugs. So we're a bespoke service here. It's a tailor-made service, and it's very difficult for me to sit and tell you how long the treatment is for addiction. Each person is different. So we would do a lot of pre-assessment calls with our potential clients to find out their history, find out their experience of life and experience of trying to change their behaviors. We will get the client in, do intensive tests and assessments while they're here, and we would make a decision then about what our recommendation would be for the duration of the treatment. I would say, as a ballpark figure, that probably 6 weeks would be the minimum to affect some kind of change. If you think that many of the people that come to us have many, many years of entrenched behavior around their addiction, and it is very, very hard to turn that round in a small amount of time. There's not a lot of research to say what are the things that really, really work in treatment. But there's one thing that they can always say has an impact on treatment, and that is the duration of the stay. So it's a fairly simple equation. The longer that you stay in treatment, the better the long-term outcomes. We're talking about affecting change that we hope people will take from the practice into their lives. And to do that, we're very, very proud of our continuing care and aftercare program. So we encourage the clients to take a counsellor with them when they go back home, to help them with that transition phase from treatment back to their own environment. This is very, very important. Often a lot of the triggers that cause them to use drugs in the first place are present in the home. The stress factors are there. So it's really important that they get that support so that they can not just maintain the gains that they've made in treatment, but also push on from them as well. And the continuing care program, we like for our clients to come back, have a top up, come back, see the same psychotherapist, check out how it's going, how's the new life working out for them, what's going well, what's not going so well, what do they need additional support with. And all this is designed to improve long-term outcomes.